ठीक है.
Okay, start.
Okay, so I would be talking about gender biasness in healthcare from the side of family members. So inequity in terms of access to healthcare, treatment, and quality of healthcare in like among the genders is very much prevalent in the healthcare system, and especially from the side of family members. It is prevalent among the women, men, and the children as well. In from the side of women, they tend to prioritize the health of their family members as compared to their own health. And since they are most of the rural women, they are mostly dependent on the male and mostly their husband in most cases. They tend to delay the treatment if they are suffering from some illness. They tend to delay the treatment because of the dependency, like they're not independent in that way. And additionally, because some in like in a lot of cases they feel guilty if they spend the money on like getting the treatment. Like they wouldn't feel guilty if someone else like from their family member is getting the same treatment, but they would feel guilty if the money is getting spent on them in terms of healthcare. Now among the children, the most, like the boys especially, if they complain of any kind of pain, body pain or some injury, most of the time they are neglected by saying that you have to be strong and these are just small things, basically trivializing their pain. So they don't get the equal access to healthcare as compared to girls. And in terms of like in the cases of girls, mostly when they complain about things like abdominal pain and stuff like that, so in that cases they are told that this is what girls go through, so this is not something big. So again, the trivializing part is prevalent here. And in cases of
Okay,
men, mostly in case of mental health, they don't access the treatment because so the inequity and the gender disparity is very much prevalent in all the genders at current time.
okay. Am I audible?
Yes, sir.
Yeah. So you could have also added the point. There is a like lack of trust in term of male doctor attending female patients. So many of the time in village area, family members or the family doesn't want to let, doesn't want to uh, go to the male doctor for their
Right.
female members. Okay,
Hmm. Hmm. Got it.
and we have also seen some crime related to this. This this has
Hmm.
also increased the mistrust or
Last level of.
uh, okay. So Adya, you when did you find that you can work better in hospital, or you started thinking hospital administration as a career?
Okay, sir. So, in 2020, my grandmother had suffered a brain stroke, and I became her primary caregiver. So, that time I would visit hospitals very often. And that was the time when I noticed the gaps, the cases of mismanagement in the hospital, and have experienced them as well. So, that this like whole experience, it motivated me to learn more about the hospital industry and about the issues it faces. Alongside, I was also studying psychology as a part of my undergraduate curriculum. So I discovered about hospital administration while studying organization behavior management. Like even that subject has its application in the field of hospital administration. So that's when it clicked me, okay, this might be possibly something that I would want to go for in terms of career. And then I started doing my own research. I came across TISS MHA, and after graduation, I briefly worked for public health professional, and then grew my interest more in the area. So that's when I decided that this will be a potential career option for me, and I would want to go ahead with this.
Okay. So how big is this problem? Like, if I'll ask you, and if I'll ask you to estimate that, why this mismanagement, cases of mismanagement, or other organizational issues that the hospital has. How big is this problem? How do you estimate that?
Sir, I can't hear your voice clearly.
I was asking that the mismanagement that you were telling me about and the other issues with
Yes,
hospital,
yes.
how big is this the
Hmm.
problem? How big is this problem? Like, have you ever tried to estimate like what is the cost of these issues that hospital has in terms of quality and ineffective processes?
Yes, sir, it is a very big issue because the patient safety is at stake. It is a matter if the cases of mismanagement are very much prevalent in a hospital, it can lead to a lot of crises, like lot of casualties as well. For example, if the staff is insufficient, in that case also they won't be able to provide the quality care to the patient. And other things as well, for example, like from my own experience, the 2 3 hospitals in fact, they did not have the proper equipment for, so we would have to take our own equipment. For example, there is a care bed for the patient so that the patient doesn't get bed sore, especially if the patient is on the bed for a very long time. Hospitals did not provide that, so we would have to carry that. But that is something which is so important, because bed sore is a very serious issue among the patients who are terminally ill or who have been in a bed for a very long time. Similarly, other devices as well. And even the hygienic condition is also a very important issue, because hospital is the unit where infections are pretty much prevalent. So if hygiene is not taken care of, it can affect the staff, it can affect the patients and their family members as well. So the mismanagement is a very big issue and need to be addressed properly.
Okay. Do you know that any other like government policies or and government bodies exist which is supposed to take care of these mismanagement? Or if it is not there, what it should be? Like, what do you suggest?
So there is a body at the central level. There is NABS, that is National Accredited Board for Hospitals and Healthcare System, which oversees and regulates the hospitals, whether it is providing quality care and whether it's ticking off all the parameters in terms of rates of infection, rates of readmission, rates of surgical medical errors. So this is the body that governs the hospitals. Additionally, there is also an act, that is Clinical Establishment Act of 2010, which is also on the central level, which was passed by Government of India. In that also, the hospitals need to register themselves under this act. But since health is a state matter, it's under the state list. So it is up to the state whether they want to apply it in their state, or they want to have their own regulatory system. So it is up to the states. Some states have it and some states follow the whatever the guidelines have been provided by central government. But it is important, yeah.
Okay. So, in recent times, we have seen there is a surge of people who are visiting or going to hospitals, uh,
Yes.
and the private practices or individual clinics are going down. So, do you think it is the right thing to be there? Because many of the times when a patient doesn't need the entire hospital, he still goes to hospital and spends a lot of money for some redundant process also, which might not be there at the clinical setup. So in this case, what is your say? Like, what will you say about this situation?
Sir, I won't say that clinics and the private practice is not needed, because in a lot of cases, the patients, when they are very sure that they particularly want to discuss so and so issue, in that cases mostly they prefer clinics. But hospitals are growing because it provides like a whole system, like if what if the patient is unsure of the diagnosis or any test that the patient needs to get done before the doctor gives the medicine or does the diagnosis. So in that cases, the patient, if the patient goes for private practice or clinic, then they will again have to go somewhere else to get the test done, wait for the reports, and go back to the doctor. So that makes the entire process even more inconvenient in a way, and it costs time as well. So I think that way hospitals are more convenient for the patient. And what I have seen is hospitals in fact charge nominal fee as compared to the people who practice privately, the doctors who privately. So in that way hospital is more cost effective and convenient for the patients. I think that is why it has been rising as well, seeing the output of the patients.
Okay. Being from psychology background,
Yes.
uh, what is the disadvantage, that advantage and disadvantage also,
Hmm.
that will you will have in order to pursue this course and career ahead?
Okay. I would like to talk about the advantage first. So, the advantage that I have is my background in psychology. I can bring unique perspective from the field of psychology to hospital administration, for example, incorporating psychological perspective techniques into the policy making and practices to provide a patient-centric care and quality, and even contribute in the factor in the case of quality management. Additionally, psychology has like a subfield of psychology is organization behavior management, which is very much important in the field of hospital administration. It uses behavioral analysis to influence and change a behavior. So there is a very famous motivation theory under the organization psychology, which is Maslow's hierarchy of needs. So this can be applied in the field of hospital as well, by taking care of the lower needs, the basic needs of the patients and the staff working in the hospital, and then going slowly rising to the higher order needs, self-esteem, self-actualization, for the entire organization to work very efficiently. Additionally, the hospital administrator can also use different effective psychological techniques of behavioral analysis, like positive negative reinforcement, performance management, feedback, to deal with issues among the staff as well. For example, burnout, compassion fatigue, stress, so that the staff mental health and well-being is also taken care of, which is one of the most neglected area in the in the field. So in that way I can contribute. One of the disadvantage that I would think, because I don't have a background in the field of commerce related, or like, so I might struggle with understanding the financial uh, stuff, because I'm not like, that is something that I've not been exposed to at all. Apart from that, even understanding some kind of medical terminologies in that way, but that is something that I can still work on it. So I don't think apart from that there will be any other disadvantage.
So have you also applied for any other MHA program?
Sir, no MHA program I haven't applied. I applied for Goa Institute of Management PGDM in healthcare management through CMAT.
Okay.
So, and
Uh,
this MHA.
so do you know the other colleges which provides the same course?
Actually, most of the colleges are providing healthcare management. There is IIHMR, even Symbiosis, but I'm not sure. And AIMS provides MHA course, which is the pioneer in this course, but they are only accept the students who are from the medical background.
Okay. So, can you tell me some stats regarding the status of hospitals of your state? Like, have you read something or related data related to this in order to prepare for interview?
Yes, sir. So in the state, there are total 51 district hospital, and roughly 80 to 85 sub district and private hospital in the state. Along with this, like, the if I talk about the health infrastructure, even the medical education also comes in the picture. So there are total 22 medical colleges, 14 are government and 8 are private.
And if given a chance, to open a hospital, or somebody asks you to open a hospital, what will be the major departments that you'll try to have in that?
Sir, in
In
my
your
city,
city, like considering your city demography and uh, the disease pattern.
sir, I would my priority would be to have a specialty in for the like neurology related, because I have seen a lot of people in my family and even like other people suffer from neurology related illnesses and conditions. And because of that, and mostly in my state, only a few, like there is a very good hospital in Bhopal, and like developed a little tier 2 cities. So tier 1 cities don't really have, tier 3 cities don't really have this, and especially in my city. So I would like to, like my priority would be to include the neurology department if I set up a hospital in my city.
Uh, what other option do you have with, like not in hospital only? What other options do you have for you after your, like, if you're not getting selected in tests?
Sir, my two interests that I had shortlisted was, one was human resource management, and the other one, because I am like passionate about healthcare and helping people, and the reasons that I have mentioned earlier. So only these two options, that is HR or human like MHA, hospital administration.
Yeah, like you have not been called for HR interview, no?
No, sir.
So tell me about the other options that you have. Like, have you, like, do you have any plan B other than go Institute of Management and tests?
Sir, I'll be appearing for CMAT as well. Through that, I have applied for colleges that have that are offering HR as well. So that would be my plan B. Yes.
So, why do you want to study this from tests? Like, why
Okay.
tests? The question is why tests?
Okay. So, sir, TISS has been providing MHA for over 30 years. And the faculty and the professors in the TISS are engaged in extensive research work. I've been on the website of TISS and have seen their publications, and I found that the research areas are very much wide, diverse. Additionally, TISS offers three field internships. So the internship will give me the grassroots level learning. So I feel that learning from the experienced faculty members, and also networking with the professionals while doing the internship, would give me, like, provide me valuable insights into the industry. Additionally, TISS offers a wide range of courses in different disciplines as well. So interacting with the students who have diverse interests would also help me in my personal growth as well. These are the two reasons. Additionally, TISS curriculum and is also like focusing on the research path, so which is something that I would want to contribute as well in the future. And one of the unique thing about the TISS syllabus of MHA is that it even lays emphasis on social justice, which is also something that needs to be addressed. So these are the reasons why I would go for this.
Okay. So now, last, tell me what are the learnings that we have from COVID?
Okay. In like we as in common people, or even in terms of the healthcare profession.
Healthcare professionals and government also.
Sir, I think so. When the first wave of COVID was still dealt with in a very organized way as compared to the second wave, and we can learn about from the mistakes that the government and the hospitals and even the common citizens made during the second wave. For example, there was the manpower was not efficient to deal with the effect of second wave, and in a way the common people also trivialized it, thinking that okay, since it has already happened, it won't come again. So the attitude of people needs to be changed about COVID, that it is not something that can be taken lightly, because it has taken a life of a lot of people. So the attitude needs to be changed about COVID. Additionally, it has taught us the importance of our immune system, how important it is to have a strong immune system that way, and importance of a life, like living a healthy lifestyle, and not, additionally, I would also say not taking things for granted. For example, like before COVID, if you get to spend a vacation abroad or even in your own country, people would not be that much grateful about. So that is something also that I would say. Additionally, spending time with your family members, your loved ones. And from the side of government, I think more strict like policies needs to be there for COVID. Like in general, like during crisis management, what can be done? So I think drills in the hospitals, simulations of crisis management if it happens. So whole like the contingency plan should be there in the hospital so that they are prepared for it, and it won't be something that would come as a shock to them to deal with an epidemic.
Okay. Are there, what's your long-term goal? Like, what do you want to do in future?
So my long-term goal is one to work in this field of like providing patient-centric care that prioritizes the unique needs of the patient. And also one of the thing that I would want to include when I am working in the hospital is taking care of the staff well-being, their mental health needs. So the burnout and compassion fatigue are the two areas, apart from other areas as well, which are very much prevalent in the healthcare professionals. So these are the two areas that I would want to work towards. Additionally, in my city, since I earlier also mentioned that the status of healthcare is not health and hospital is not up to the mark. So in long term, I want to set up a hospital in my city, especially prioritizing the neurology. Apart from that, other major illnesses, especially in since the state go like infant fertility in sorry infant mortality rate is very high, so like maternal and child health care.
Okay. Okay. So the last question for you.
Yes, sir.
Give me like 5 advantages that India will get if
Hmm.
they work on efficiency and quality in terms of hotel administration or hospital administration.
So can you repeat your question?
Give me some advantages that India will get
Hmm.
if the India Inc. is working towards good quality services in hospital.
Okay. So, sir, in it would help even increasing the health of a society. Health of society means overall well-being of a society because, uh, especially like it would reduce the overburdening in the hospital, and the hospitals will also be able to provide quality care to the patients. And additionally, I think it would even be on the part of like hospital, the staff basically, even they will have the positive mindset toward their work that way. And I think, yeah, these are the two issues.
You should have added more points here: medical tourism,
Tell
economic advantages,
it can also help
social.
in
It will also help in
economy and
eradicating
development
many
of the
social issues,
economy and development of the.
employment, everything. Matlab, it would have helped in everything. The last answer was disaster from your side. This was good. है ना?